Sorry, my doctor friend. So there was some issue at home, so I couldn't do 10 notes in eighth video. There was nine only, and it's uploading, and we are going to upload the ninth video because time is limited. We have to learn a lot, so maybe a little less or more will be a difference. I don't know what was the terminal point. Eighth video. A structure preserved during moderate radical mastectomy. Uh, Long thoracic nerve, thoracodorsal nerve, cephalic vein, axillary vein. Vein is six inside, great saphenous vein at the ankle or at groin. Basilic vein at the arm, cephalic vein at the deltopectoral groove, inguinal ligament, Popper's ligament, lymphatic drainage of colon, epicolic lymph node, wall of colon, pericolic lymph nodes, vasa recta, intermediate lymph nodes, ilio, right, left, midcolic, and sigmoid branch. Principal lymph node, superior and inferior mesenteric arteries of aorta, venous drainage of rectum and anal canal, 11 o'clock anterior and right, 3 o'clock anterior and left, 7 o'clock posterior and right. The portion of neck giving attachment to Hartmann's pause is known as isthmus of gallbladder, crypts of Lusaca, mucous membrane thrown into innumerable folds sink into muscle coat. Common bile duct 7.5 cm is divided into four parts: supraduodenal part, retroduodenal part, infraduodenal part, intraduodenal part. The ventral duct and distal portion of the duct dorsal fuse and form the main pancreatic duct. Duct of Rushing. The proximal portion of the dorsal duct forms the major pancreatic duct. Duct of Santorini. Appendix has base, body and tip, 2 to 20 centimeter base of appendix attached to posterior medial wall of cecum, 2 centimeter below ileocecal junction. The portal system of vein carries blood from abdominal part of gastrointestinal system, spleen, pancreas, and gallbladder to the liver. Preganglionic sympathetic fibers, acetylcholine. Postganglionic sympathetic fibers, noradrenaline. Except postganglionic fibers to the sweat glands, preganglionic parasympathetic, ACTH, postganglionic parasympathetic, ACH. Boundaries of axilla: anteriorly by clavicle, posteriorly by upper border of scapula, medially by upper border of first rib, laterally by coracoid process, contains of axilla, vessels and nerves of upper limbs, two head of biceps brachii, origin of coracobrachialis, loose areolar tissue and the lymph nodes, branches of arc of aorta, brachiocephalic trunk, left common carotid artery, left subclavian artery, arteria thyroidea. FNAC is superseded by core needle biopsy. FNAC sensitivity true positive, 80 to 98% false negative. 2 to 10% specificity is 100%, as false positive is very rare. Side effects of chemotherapy: nausea and vomiting, alopecia, myelosuppression, cardiac toxicity, adriamycin, premature menopause, second malignancy, breast carcinoma 1 to 3 positive node, 5-year survival 60%, more than 4 nodes positive, 5-year survival 30%. Reaches hernial sac contains a portion of circumference of the bowel. Dull aching pain, chronic cholecystitis, stabbing, pancreatitis. CT scan staging of carcinoma stomach. Stage 1 intraluminal growth without wall thickening. Okay. Stage 2 wall thickening more than 1 centimeter. Stage 3 direct invasion to adjacent structure. Stage 4 metastatic lesion to liver, lymph node, and other distant site. Chemotherapy of gastric cancer, epirubicin plus cisplatin plus 5-FU effective drug. Patients with advanced stomach cancer, resuscitation with IV fluid, blood transfusion, endoscopic treatment, electrocautery clipping or injection of adrenaline, angiography, and coil embolization. And the last portion is cut. Methods: fail, surgery, limited resection, something like that. Half letters are cut. Okay, we have to guess. Okay, next one. It's far better than having no notes, so I guess it will be still helpful. Okay, my friends, we continue. Eye signs: exophthalmos, forward bulging of eyeball, dalrymples and visibility of a shoal due to spasm of upper eyelid. Von Grab's sign is positive if lid lag is present. Jaffery's sign: loss of wrinkling of forehead. Mobius sign: failure of convergence on accommodation at a near object from a distant object. A Stelwag sign: infrequent blinking in Hurthal cell carcinoma, evidence of capsular and vascular invasion. Treat pheochromocytoma with adrenalectomy and then treat medullary carcinoma of thyroid. Trendelenburg test is done to check varicose veins. Fagan's test to localize dilated perforating veins. Complications of foam sclerotherapy are DVT, pulmonary embolism, superficial thrombophlebitis, headache, transient confusion, vasovagal reaction, visual disturbances, allergic reactions, skin pigmentation. Crossed leg or physics test. If oscillatory movement positive, popliteal pulse positive. If oscillatory movement negative, popliteal pulse is negative. Different types of hemangioma: salmon patch, port wine stain, strawberry angioma, spider nevus. Our neighboring lady has plexiform neurofibromatosis. Now, this is a case that I have written according to my own experience. Our neighboring lady has plexiform neurofibromatosis involving left side of face. CAR test is used to test palmar interesting squamous metaplasia of transitional epithelium, renal pelvis, and urinary bladder. Premalignant lesions in the skin, Bowen's disease, radiodermatitis, solar keratosis, leukoplakia, xeroderma pigmentosion, chronic ulcer in the skin. Pathological types of soft tissue sarcoma: malignant, fibrous, histiocytoma 28%, liposarcoma 15%, leiomyosarcoma 12%, synovial sarcoma 10%, malignant peripheral nerve sheath tumor 6%. Root values of the following important nerves: ulnar nerve C8 to T1, median nerve C5, C6, C7, C8 and T1, radial nerve C5, C6, C7, C8 and T1, axillary nerve C5 and C6. Hyperthenar muscles: palmaris brevis, abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. Thenar muscles: abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, adductor pollicis. Cyst: fluid contains cholesterol, brachial cyst. Dental cyst: hydrocele fluid, thyroglossal cyst, dentigerous cyst, cystic hygroma. Gross types of carcinoma: check exophytic and proliferative lesion. Ulcerative lesion, varicose carcinoma, causes of gynecomastia, secondary to some drug therapy, digoxin, spironolactone, anabolic steroids, or estrogens. Carcinoma cecum and descending colon, right hemicolectomy, right colic flexure, extended right hemicolectomy, transverse colon, extended right hemicolectomy or transverse colectomy. Sigmoid colon resection or extended left hemicolectomy. Gallbladder is held by Moynihan's cholecystectomy forceps. At closure, a drain is kept at the hepatorenal pouch of Morrison's. Relative distribution of breast carcinoma: upper outer quadrant 60%, upper inner quadrant 12%, lower outer quadrant 10%, lower inner quadrant 6%, central quadrant 12%. Different techniques of disinfection of instrument: boiling at 100 degrees centigrade for 5 minutes at lower pressure, formaldehyde vapor at 50 degrees centigrade, glutaraldehyde solution in 2% for 15 to 20 minutes, low temperature steam exposure to dry saturated steam at 73 degrees centigrade for 20 minutes, and subatmospheric pressure. Any difficulty in eye movement: third, fourth, and sixth nerve palsy. Any difficulty in chewing: trigeminal nerve palsy. Any difficulty in speech: vagus nerve palsy.